Good evening. If you're ready, I will start. Hi, my name is Melissa. I am presenting the RMO application evening night in conjunction with AMA. The Postgraduate Medical Council run this process centrally, and other people from WACHS, PCH and KEMH will also be talking on behalf of their hospitals, so you get a bit of a broader knowledge of the different areas that you can go into. Okay, so we're just going to go through the application process, plan, prepare, and what you need to submit. WA Country Health Service will then get up and speak, KEMH and PCH, and then we'll just go through BPT. Can I just grab a show of hands if you're already working as an RMO in the WA health system? Okay, and those of you that are international medical graduates or are not in the system? Okay. So there are two different processes depending on whether you're in the WA health system or whether you're external to the system. I'll quickly go through the RMO process for those that are already in the system. Some of you may be on a 3-year contract with WA Health because you are one of our interns. If that is the case, you will be given the following two options on your application. It will be either to stay at your current site. It is a shorter application. You don't need to provide documentation. It's just indicating that you're currently on that contract and you are wanting to stay on that contract. No CV or selection criteria is required for that. However, if you do want to change sites or you're already at a specialist site, so you're at PCH or KEMH, we will ask you to complete a full application because you may want to change sites, but also because specialist sites are highly sought after, we do ask you to fill in a full application. And then if you're external to the WA Health Service, you will be automatically directed to fill in a full application. There's a lot of documentation that is required for this, so preparation is vital. So these are your key dates. Process is currently opened on the 15th, and the applications close on the 12th. These are your main periods. We then go through a breach period, so you will probably get limited contact during this period. After the breach period, we start on offers. We go through your specialist site offers first, so that's PCH, KEMH, WACHS, and anyone that has asked for a split contract, so where you've asked for 6 months at one site and 6 months at another site, these offers are done during this period as well. Then we go on to first preference sites for all other sites, so Charlie's, Royal Perth, Fiona Stanley. After that period, we'll open the pool up and every site can offer to anybody. So it is an ongoing process. Please don't feel that if you haven't got an offer in the first two weeks that you're not getting an offer. That is not necessarily the case. It takes a while. It is a long application process. Please be patient with us. The pool will be closed on the 9th of October. After this date, that's when we send out all the emails saying, if you haven't already received an offer, unfortunately you're unsuccessful in this recruitment process. The position is up on WA Jobs and then on Med Jobs. You apply through Med Jobs, although the information is available on Jobs WA. The application guide is quite extensive. Please read through it. It will give you almost every answer that you're looking for, and then if you have any additional questions, you can email through to PMCWA.RMO and we can assist. Also on the PMCWA website, these documents are available as well. Okay, so the job description, similar to, I'm sure, what you've seen before. And this is what Jobs WA will look like. You need to don't type in RMO, it won't come up. Make sure you're putting in Resident Medical Officer and it will direct you to the correct place. This is exactly what Med Jobs looks like. This is the current ones. And so when you apply to a full process, you're going to be asked for your CV, maximum 3 pages, and then your selection criteria. All the selection criteria that is applicable to you, please answer. Maximum 500 words. Obviously, some of those may be slightly shorter. If you are planning on applying to a specialist site, there are additional essential criteria that you will need to answer as well. There is desirable criteria. Please answer those as well. We need your a cover letter is optional, but if you are wanting part-time or you want to, it's not written in your CV or selection criteria, something specific that you're wanting to do, that is a reason for your cover letter. Sites will look at them and assess term allocations and just it gives a broader picture of if you are wanting something slightly out of the box. If you are not from Australia, we need proof of citizenship, any visa documentation, so if you have VIVOs, we would need a copy of those, your passport details, English language documentation, end of term assessments, these are optional, but if you do have any of that kind of information from where you've done your internship or at home, that's of benefit, just gives us a bit of a broader picture, and then your AMC certificates and questionnaires. Okay. I am going to hand over to Katty from AMA. If you want to use this one. Okay. Cool.
Hi everyone, I'm Katty. I'm a current RMO at Perth Children's Hospital, but I've also worked with the AMA. I'm just going to go into a little bit more detail about the three elements of the application that involve a little bit more work and definitely require a lot of effort, especially when you're applying for the more competitive positions. So first up, the cover letter, as you've already heard, it's optional and it really doesn't need to be too long, but it's really for if you have anything in particular that you need the hospitals or the sites you're applying to consider. So it might be, like you've heard, around particular rotations and requirements for your training, or it could be a bit of context to say you've taken a bit of time off to do research or another job and you're re-entering clinical work. Just anything that doesn't really come through in the main parts of the application. So your CV is really important, as probably obvious, but it's essentially a document packaging you and selling yourself in a work sense, but it needs to be maximum of three pages. I was told recently that people looking at CVs spend about 9 seconds or something looking over your CVs, so it really needs to be easy to read, it needs to be clear, and you need to have your main qualifications and the highlights front and centre so that people will know why you're the best person for this position. So probably telling you things that you already know, but a lot of people already have a CV that they've got on the go and you just need to update it every year. But sometimes it is really useful to just start from a bit of a starting point and brainstorm your particular strengths and skills and attributes, have your successes and things that you've done really front and centre, as I've said, and have the elements about yourself that make you different from the other people who are applying to the hospital you want to get to. As I think in different sectors, people do tend to put their skills really up the top. So, skills in research, project management, communication, speaking a language, whatever. There's definitely scope for that in medicine as well. So if you have particular skills that maybe other people don't have, like in research or language or anything like that, then definitely have that in your CV as well. As I've said already, make it easy to read, make it nice to look at, and that's the main thing. Usually work backwards from chronological order, so the most recent things first, and obviously spelling and grammar needs to be correct. So this is a sort of suggested structure. There's no right or wrong structure, but you can easily find them online or in templates and that sort of thing. Then there's the referees. You need to have 2 referees. They really need to be relevant for the position that you're applying for. If you've been working clinically, it's most appropriate to have some term supervisors or at least someone senior who you've worked with recently, and that's what most hospitals would be expecting. It's often a bit of a balance between finding someone that's renowned and highly respected or senior in the hospital and someone who actually knows you and would be able to answer questions about you. In any case, you need to let them know that you've put them as a referee, and so that they will be expecting a call if they get one. So really quick checklist, as I've sort of hammered on. It needs to be attractive, needs to be positive, and really highlighting you as a person for the application. It is a little bit embarrassing sometimes to some people, but it is also a good idea to get someone else with a fresh set of eyes to look over your CV and proofread, and make sure you basically just don't leave it to the last minute, because that's when you'll make silly mistakes like putting the wrong position or dates or something like that. So the selection criteria are definitely the most work, and I'd really recommend getting onto them sooner rather than later. There actually aren't any word limits for these, but as you can imagine, when people are going through hundreds of applications, having clear, succinct answers is better. Make sure you answer the questions that you are meant to be answering. So the criteria seem to, at some points, to overlap slightly or have commonalities, but definitely never copy and paste the same answers to different criteria. Basically, the aim is to show through actual concrete examples how you exhibit those criteria in your work, and that's why it's really important to have specific examples. Obviously, again, it's important to be positive and detail successes. Important as well to use the active phrase, so that I did this, I worked in this, and then have an outcome. So yeah, there's a couple of different models that you can use. It really depends what your preference is, but essentially having a situation, so I was on this rotation and was seeing a patient with this condition. My role was to do something, whatever, and I did that thing, and then this was the achieved result. It doesn't have to be, always the most amazing result, but it could be that you've learnt something really important from it, or you worked well in the team environment and that sort of thing. Okay. This one's pretty obvious. The being eligible for the registration of the Medical Board of Australia, just answer, yes, I am, etc., etc. The clinical experience of at least 6 months, again, that's pretty much yes or no, but just write that you are. And then the next 4 are sort of the main ones. And as I mentioned before, they seem to kind of overlap slightly, but it is really important not to use the same example for both, or for several, and definitely don't say C above or something like that, because the people marking the different criteria, there are different people marking different criteria, so they will just be see each criteria answer completely blindly. The last one, obviously, is do you have a driver's licence? Can you make it to your work? That sort of thing. If you do, then just say that you do have a car, you can access public transport, and you can get to your shifts. Then, as we've already heard about, these are the additional selection criteria for if you're applying to a specific site. So you can read those there, you can see them online. I'm not going to read out the slide for you, but a few of you might be applying to several of these sites, and you'll just put the criteria for several of them in your application. Even though it will go to, say if your first choice was WACHS and you also had PCH, you'd answer both of those in your criteria. And as we've already heard, these are the desirable selection criteria, so you don't have to answer them, but I would strongly recommend that you did. Having commitment to continuous improvement of patient outcomes, including participation in clinical audit and research. Obviously, if you've been involved in anything that is remotely research-based, or you've helped out your senior colleagues on an audit, then put that in there. You'd also probably want to have that in your CV, so jog your memory for those sorts of things. And So then commitment to medical education and teaching, supervision skills, legislative obligations, and then PCH and KEMH is at least 2 years of current clinical experience post-graduation. That's, again, that's a yes or no question.
But that's desirable, right?
It's desirable, yeah. I've already touched on this quite a lot, but keep it brief and concise, succinct. If you're saying that you're a really good communicator but you're waffling on and not really making much sense, then probably it's a little bit counterintuitive, but use relevant examples to the criteria, of recent if possible, so in the last year or two. Again, be positive. The presentation, again, is very important. Space it out, write down the criteria, repeat the criteria, so don't say one and then answer. And always flick back to the job description so that you're answering some of your attributes with the duties that you'd be expected to do as an RMO. I've already said quite a few of these, but don't say see response above. Probably goes without saying to keep everything confidential if you're using any patient examples. Don't use jargon, abbreviations or acronyms. And basically make it easy for the people who are going to be looking at your application. With the track changes in Word documents, I'd probably recommend making it a PDF when you upload anything. That's just a little tip. And with the expecting to be known, even if you're applying to a hospital that you already work at, you can't assume that the person knows you. They may well know you, but they can't mark your criteria as if they do. So you have to start from scratch, essentially, and say what you've done and how you're good at communicating, how you're good at organisational skills, that sort of thing. Okay, I'm going to hand over to WACHS.
Can I just say something along the slides being organised? On the CV and your selection criteria for the PMC, make sure in the footer you put page 1 of 5 or 1 of 3, and name, sometimes
that's right.
outside Chris.
What?
Do you want to go to the first one?
That might be easier, yeah. Okay, hi, I'm David Oldham. I'm the Director of the Medical Education Unit for WA Country Health Service, and I'm here to tell you why spending some time, be it a term, a year, a few years or a lifetime in the country is a great idea and something you should all have a chance of doing. This is going to be a co-presentation. I'll be talking a bit about what the work's about, and then the manager of our unit, Nicole, will talk to you about how to apply for a position with WA Country Health Service, or WACHS, as we call it. So, this is a quote from an intern a couple of years ago, and I think it pretty well summarises all the great things about working in WACHS. And if you look at the map there, the big stars are our major hospitals. So we've got 6 major regions: Broome, Port Hedland, Geraldton, Bunbury and Albany. And then we've got the smaller stars, which is where residents can go to, including Kununurra, Derby, Karratha, Esperance, Narrogin. I think I've got them all. So lots of different opportunities, and we find some people go to Albany for a year or two and then they go out to Broome, so you can go across the state working with WACHS. So these are the different placements available for residents. We have 12-month positions in those major hospitals that I talked about. So there's lots of opportunities there, particularly in Bunbury. And then if you're based at one of the tertiary hospitals, Royal Perth or Sir Charles Gardner, so Royal Perth has plenty of rotations to Kalgoorlie, and Sir Charles Gardner has rotations to Hedland and Karratha. Fiona Stanley doesn't have any rotations. Except for the community residency, which I'll talk about in a moment. So why should you go rural? What's different about rural? Why is it better than working in the city? Well, first of all, you're not just a resident. The reality is, in the tertiary hospitals, They have about, I think all of them have about 150 to 200. If you understand, you might even have 250 residents. So you really just align on a matrix for them. They just line you up and you churn you through, and they do look after you a bit, but you're not as well known. A lot of the senior doctors don't know who you are. Sometimes your own consultant doesn't know who you are. They wouldn't know your name. But as a resident in WA Country Health at one of those hospitals, everyone will know your name, from the cleaner through to the hospital superintendent. You'll be a key person of the workforce and they'll rely heavily on you and make you feel welcome. Second, you get real hands-on clinical experience, again in the tertiaries. Unfortunately, with the trend to subspecialisation and busy throughput, often you spend a lot of your time just doing the paperwork, the discharge summaries, and it's possible to go through a term without even examining a patient in some of the specialty rotations. Whereas at a rural hospital, you really get a great clinical experience, hands-on. You're seeing the patient at admission, you're treating them on the ward, and you're looking after them at discharge. The other big thing, work is only 5 minutes away. You're only based at the one site. You don't have to travel down to Rockingham or up to Joondalup unless you live up Joondalup Way, or go out to Midland. In those country hospitals I've talked about, 5 minutes would be a long trip to work. Often don't even have to go through a set of traffic lights. So it's a great lifestyle and very convenient. You can have those sleep-ins, and at the end of a night of a late shift, you don't have to worry too much about a long drive home. And finally, you're part of the community. You're not just someone in the hospital. The community will get to know you. A lot of people join sports teams or groups, cultural groups, dancing groups, art groups. There's lots of opportunities in the country, and they really try to make you feel welcome. Now, Nicole's going to talk to you a little bit about how to apply for WACHS. That's the bottom left.
Bottom left, okay. So Mel already mentioned there's a couple of different aspects to the application process for RMOs. So you're either going to be indicating that you're staying, or you're going to be indicating that you're moving. So as Mel said, you go into med jobs and you follow the prompts. Whether you're moving from Metro or you're new to the system, if you want to work for WACHS, rank WACHS as your first preference. And then you'll need to rank at least 2 of your preferred WACHS hospital sites. But we recommend that you rank more than 2, because if you happen to choose the 2 most popular sites that get oversubscribed, it's good to have a third option for us to direct your application to. And then you put in your desired type of employment and so on as per the application. So Mel and Katie mentioned your cover letter, your selection criteria and your CV. All of those things apply to a WACHS application as well. But it's also really important in your WACHS application that you get in everything that you need us to know about you, why you're looking for a rural career or a rural rotation, and why what you've done in the past to lead you to this point, so any rural research that you've done, any rural clubs that you belong to, any previous experience or a background in a rural area, and then let us know what it is that brings you to WACHS. And in your cover letter, it's also a good place to put any additional information. I think Katie mentioned if you've got something that you really want the employer to consider that's different or unusual, put it into the cover letter. For example, you and your partner both want to go to Bunbury, and if you can't both go to Bunbury, you want to stay in the metro. You can put that into your cover letter, and that's what we will take notice of. You can tell us anything that you think will really make a difference to your application in all three places. Weave it into your selection criteria, get it noticed in your CV, pop it into the cover letter. That's the place that you can really sell yourself. Now, if you are already working for WACHS, I'm sure you're not in the audience right now, but if you are, come and talk to us later. People on 3-year contracts with WACHS do get a different priority way of moving through the system. So the other thing to notice about WACHS that's different is that we do interviews and they occur in July or August. So it's important that you know that. If you're going off and having a holiday or something like that, make sure that you you have your phone on or you leave a message about how you can be contacted during that time. If you want to go to Royal Perth or Charlie's and you want to have a rotation, once you're successful in getting a contract with one of those sites, they'll send you information about preferencing the rotations that you want in their matrix, and that's your opportunity to request a rural term. They're very, very good at working with us to try and make those sort of things happen. If you want something different, multiple terms and so on, we can work together. Okay, back to David.
Okay, thanks, Nicole. So I'm going to talk to you about 3 special programs that are open to you as residents. The Community Residency Program, Workplace-Based Assessment for International Medical Graduates, and our brand new Aspire program for those of you who might be interested in surgical training, either as a GP or as a specialist general surgeon. So I'll go through those one by one. First of all, the Rural Community Residency Program. This is where, if you're working at Fiona Stanley, Royal Perth or Charles Gardner, so if you're at Fiona Stanley, you do get an opportunity to participate in this. You can do a 1-term rotation into the country, and I'll go through the placements in a moment. Each one is unique. We select them mainly on their experience. So a lot of the jobs are largely supernumerary, so they exist primarily to give you a really good experience, a really good training experience in the country. The unique thing about them is 20% of your clinical time must be done in a community setting. So that could be time in general practice, a day a week in general practice, or an Aboriginal medical service, or a remote outreach clinic. If you're up in the Kimberley, you might go to some of the Aboriginal missions, or out with a nurse, or even out with the flying doctor service on some things. So the feedback we get from these has been absolutely amazing, and 99% of people have a great time. The other thing is the supervisors are really motivated. Often they really look forward to the new community resident coming along, and they try to make you feel welcome and really look after you. We do have a flyer, so down the front here, if you're interested in the community residency program, grab a flyer before you leave tonight. Where can you go? So there's Kununurra, there's Derby, there's Karratha. We've got a new position coming up next year in Port Hedland, which is mainly based in paediatrics, but you go out to the remote Aboriginal clinics at Jigalong, Yandi Yarra, Warralong, and have a great time. Geraldton, we have a new paediatrics position in Geraldton next year, and you'll do community outreach to Meekatharra, Mount Magnet, Morowa, and the local Aboriginal Medical Service Clinic. Kalgoorlie's paediatrics experience. Esperance, you get really involved with the general medical ward and the GPs there. And Narrogin, same thing, again, a great general medical ward and GP experience. How do you apply for the community for a term rotation? You do it through the centralised, when you're applying for an RMO position, you'll be asked, would you like a community placement? And you say, hopefully you say rural only, or metro or rural. And then if you select that, you'll then be prompted to give more information. And for the rural CRP, you'll be given those choice of 8 locations and you'll be asked to select at least 3 of them. And I think in the years we've been running it, everyone's pretty well got their top 3, and often you get your first 1 or 2. So there's a very good chance of getting what you want. And we do look at each application individually and really spend a lot of time trying to get you that. You will be asked to attach a statement of interest, so you'll be asked separately as part of this application to say why do you want to do a community residency placement, and you could perhaps say why you have chosen your top 3, and also submit your CV. For those of you who are putting in the new application, you have to attach a CV anyway, but if you are just renewing your contract, I don't think you're asked to put in a full CV, but you will if you want a community residency placement, because we don't know your prior history, so we need that CV so we can assess you. Okay, the second exciting program offered by WACHS is workplace-based assessment. And Nicole and I will be staying on behind after this session, so if anyone has any particular questions about anything I said, but in particular the workplace-based assessment, come and see us afterwards. It's a 12-month assessment program, and it's an alternative to the AMC clinical exam. So at the end of the 12-month program, you get the AMC certificate. There are 3 locations in WACHS that offer workplace-based assessment. They're in Bunbury, Geraldton and Kalgoorlie. First of all, you have to apply for a position, and usually it's as a resident. Some people apply as a registrar, but once you have a position at one of those locations, you can then talk to them and say you'd like to do the WBA program, and they will talk to you about that. When you talk with them, you also have to do some required supervised experience, and you can talk to them early in the year about whether you can get term rotations that you're doing can count towards the requirements for the medical board's supervised practice. Once you have done the supervised practice requirements, together with your AMC certificate, you're then eligible for general registration. Again, we have a sheet on the workplace-based assessment here, so pick that up if it's of interest to you. The third exciting program that we've got, and this was just signed off this week, so this is hot off. You're the first group that we've told about this, and this is our Aspire program. And this is for anyone who's interested in being a GP surgeon or interested in being a general surgeon practicing in a rural area. So there will be 2 positions, and each one will have a 2-year contract. One position will be employed by Albany and one position will be employed by Bunbury. So next year is the first year of this program. So in 2020 you'll be employed as a resident, and in 2021, your second year, you'll be employed as a junior registrar. And at the end of the 2 years, you will have met the advanced skills training requirement to be a GP surgeon, or you will have fulfilled all of the prerequisites to apply for general surgical training. So we're working very closely with Dr. Tom Bowles in Albany, who's the surgical lead for WA Country Health, and he's been liaising closely with the College of Surgeons, ACRM and the College of GPs on this. So it's a really exciting looking program, and we do give a few carrots as well in terms of accommodation, travel and professional development assistance. So what does it look like? For participant 1, who's a Bunbury employee, the first 30 weeks are based in Bunbury doing surgical rotations and emergency, then moving to Albany for the last 2 terms doing general surgery and orthopaedics. That person in their second year then stays at Albany to do as a registrar to do general surgery for 26 weeks, then switches to Bunbury for their last 6 months doing general surgery. And the second participant starts at Albany but does a similar set of rotations. So if you are interested in doing surgery, then it's a great and unique opportunity to do it. So how do you apply for the Aspire program? Apply to WACHS through the centralised recruitment process, ranking Bunbury or Albany as your first preference. You have to be employed by Bunbury or Albany. You can mention an interest in Aspire in your cover letter. If you are recruited by one of those hospitals as a resident, you will then be sent information about the Aspire program and asked to complete a formal expression of interest. So you have to have the job first before you can express interest. And again, we've got a flyer on the Aspire program. So that's all about WA Country Health, lots of exciting opportunities. We do have other flyers there that tell you generally about applying for a job in WA Country Health. We've also got flyers for each of the regions with some nice, pretty pictures of people swimming in the ocean and fishing, so four-wheel driving. So grab one if you're interested. And you can contact our medical education unit by phone, email, website or Facebook. So hopefully we'll see you there either for a term or for a year or longer. Thanks very much, and we'll be staying behind at the end.
Just going to hand over to Louise Farrell from King Eddie's.
Well, I think you should all come and work at King Edward because it's a lovely hospital. I first went there 45 years ago as a fifth-year medical student, and I always say the reason why I did ONG was because I thought King Edward was the nicest of the hospitals to which we were consigned as undergraduates. So we're over 100 years old, and we're a tertiary referral centre for ONG, gynae-oncology and neonatology. We've got 200 beds, we've got 100 neonatal intensive care cots, and we do about 6,000 deliveries a year. So we're a women and newborn health service. Now, everyone knows about obstetrics, and of course King Edward is linked to obstetrics as the hospital that is does the largest number of deliveries in the state, and is well known for looking after premature babies. So the neonatal intensive care unit, we take babies from all gestations, and no other hospital takes babies under 32 weeks. So we have that special ability because of our nursery to look after all gestations. Probably a little less well known is our gynae services. And we do run a pretty comprehensive care range of gynae services. So we look after all age groups. We look after the babies. We probably don't look after too many of the young women because they are looked after at PCH. But then after that, we look after women gynaecologically. We have a breast screen service runs out of Women's and Newborns Health Service. We have a gynae cancer service. Colposcopy, I'm the head of the colposcopy service, endoscopy, we have family planning, genetic counselling, a mother and baby unit, so we look after women with mental health issues, a big menopause service and a menopause after cancer service, physicians' clinics, we have a very big urogynecology service, and we also have ultrasound radiology. We have sexual health clinics and the Sexual Assault Referral Centre. When you come to King Edward, it does involve off-site rotations. We do rotate people to Joondalup, Osborne Park, Rockingham, Fiona Stanley, Bunbury and Kalgoorlie as residents, and as registrars we also rotate people to Geraldton. So there's a lot of clinical experience at King Edward. There are wards, ward rounds, clinics and theatres, labour ward and emergency centre. We have 6 rotations a year, so they're 8 to 9 weeks. We have a very strong focus on education, and you might have all noticed we got an A in education in the recent AMA survey. Our previous director of ONG refused to ever allow the term service registrar to be used in the hospital, and we don't have service registrars, and her reason for that is all junior doctors are receiving some form of training. So we call the registrars who are not the college training registrars RANZCOG registrars. So there are these different qualifications you can get through the college. There is the diploma, and you can either do a basic or advanced diploma. So the basic diploma, you would need to spend at least 12 months at King Edward. If you're going to do the advanced diploma, you'd need to spend a minimum of 18 months. The Certificate of Women's Health doesn't allow you to provide intrapartum care, but allows recognition that you have got special expertise in women's health. And that's very realistically achieved in a 6-month rotation at King Edward. Now, the RANZCOG training program has restricted entry, and it's quite a competitive process. We only take a small number of registrars each year because we need to ensure that they get proper surgical training and get proper surgical workload. We usually take somewhere between 6 and 8 trainees a year. To get onto the RANZCOG training program, you have to have done at least a year as a resident in ONG, and most people getting onto the training program have done more than that. It was mentioned that we prefer to take PGY3, but we certainly do take PGY2. As I say, we've got a very strong focus on education. I've got a fantastic senior registrar who will be taking over my job next year, and she is absolutely the guru of simulation, and she came from the UK, she came from Bristol, where they'd really devised a lot of the simulation training in obstetrics, and she set up, before she did her training as a specialist in Australia, the in-time training courses at King Edward, which are the team management of emergencies, obstetric emergencies. We run 6 a year. There are 4 obstetrics and 2 gynae. We also run advanced fetal assessment courses, and we have 4 of those a year, and that's obviously an integral part of obstetric care. We've got quite a lot of resources for learning. One of my previous senior registrars set up the emotional wellbeing sessions. They're held once a month, and it's preceded by lunch, and it's an opportunity for junior staff to share their stories and have confidential supportive chats regarding emotional response to the care that they're giving to patients. There's one of the psychiatrists always attends, not to provide psychiatric counselling, but basically just to make sure that people are on the right track and perhaps pick up if there are any major issues. We also have a great thing called the attendance tracker. It's a thing on your phone. All our meetings at King Edward are recorded on the attendance tracker, and all you need to do is scan it on your phone, and it's fantastic because it gives you, so this is what a barcode looks like. So you scan it on your phone, and the thing is you have a record of it, and you can just send yourself, print a request thing, you push request, and that sends you a list of everything. It emails you a list of every message you've attended. Now, those of you who've had an APRA review will know that they do randomly audit education activities of all medical practitioners, and people get quite shocked when they get a request from APRA for an audit of their educational activities. And people are always, or used to always, ring us up, can you send us a record of what meetings I've been to? This is on your phone. You can press a request, you get an email, everything you've attended is there, and it's a fantastic thing. I don't know why all the hospitals in Western Australia don't have them, but we're ahead of the bunch. So we also have Moodle, which is, those of you who've worked at Charlie's will know that it's a learning system, and it's a big resource, and you can use it outside the hospital as well. We have lots of useful resources on it. We have all our mandatory education, our survival guide, all the forms, information about us. So it's a very useful source. And our medical education officer has set up a doctor's workspace, and with a single click you can go into all the information, all our educational activities, reoccurring courses, things about if you're sitting for the RANZCOG, we have morning tutorials every morning, we have teaching every Friday afternoon, and it's all there. So why come to King Edward? Well, it is a small hospital. We have a total of 70 residents, and they're rotated to the peripheries as well. There's lots of opportunity. We have a very heavy focus on education training. We do very well in all the college exams compared with other states, and we did very well in the AMA survey, as I like to say. So we've got a very heavy focus on education training. There's lots of fun to be had at King Edward, and we're just really lovely people.
Hi, I'm Rachel. I'm a general paediatrician at Perth Children's Hospital, and I'm in the very privileged position of being able to comment on everyone else's talks because I'm coming last. So before I even start my talk, I can say that as part of paediatric training, we go to rural sites, so we can offer what WACHS offer. We look after neonates, both at PCH and in peripheral sites, so we can offer what King Eddie's offers, and we've got a bit of adolescent gynae as well, so really you don't need to bother going anywhere else because we've got it all. And we're not 100 years old, but we're 1 year old, and we're lovely and shiny and new. And after a few little teething difficulties and a 4-year delay, we've got a beautiful state-of-the-art hospital, and it really is a very nice place to work. Worth mentioning the excellent food options. If you guys are interns, you'll appreciate that. If any of you are Charlies, you've probably already nipped across to get a burger or two at PCH. And it really is nice to be somewhere where you can have a decent cup of coffee and actually have a proper chill out in between ward rounds and whatever else it is that you're doing. So I've grown to appreciate that compared to the PMH food, which was inedible. PCH offers a really good supportive working environment. So I don't know if you guys are all aware of the AMA health check from a couple of years ago where we scored 8%. We can say that we've turned that around, and we scored in the high 70s this year. So we're still not maybe an A like King Eddie's, but we're certainly on our way up there. And because of that big dip that we had a couple of years ago, PGME at PCH and the exec are really putting a lot of effort into making it a better place to work and making sure that the junior doctors are well looked after and well trained, so you don't need to worry. And we have fantastic teaching and training facilities. Our sim suite is high fidelity sim suite, and it's one of the best in the world. The operating theatres are just an exact replica of the operating theatres that we have in the main part of the hospital. And of course, the main reason why you want to do paediatrics is because the hospital is full of cute little children. So we look after everyone from age 0 or less, so somebody from 500 grams up to 150 kilos is what you could be dealing with if you work at PCH. And we really do see absolutely everything, so everything from a child who's got a complex congenital condition with every system in their body involved, through to a cute little healthy 2-year-old who stuck a pea up their nose. So we also look after adolescents and older young people, as we call them, and that could be everything from people who've been unwell their whole lives to people who've got new injuries or illnesses, eating disorders, mental health, the whole gamut. So everybody in between, all the little cuties are ours. What do we do at PCH? We basically, everything you do in the adult world, we do at PCH and a lot more. So I'm not going to bore you by reading every single one of those things, but you can see that if you've got an interest in anything across medicine, we can pretty much offer training or experience in it at PCH. What do paediatricians do? So Paediatrics, the first 1,000 days of your life are known to be some of the most important days for the whole future of your health. It's an area of greatest need, so we look after refugee health, Aboriginal kids, we look after disadvantaged children, we look after Western suburbs perfectly well children, we look after everything absolutely across the board, and you will find you'll never have a dull moment looking after these patients. We offer excellent research as well. So we're co-located with TKI, and Telethon Kids Institute and Perth Children's Hospital have made a real effort to work together so that we're trying to support junior doctors at grassroots to get into research. So I was not researchally inclined at all, and they've been so encouraging and really offered audit programs, support. The TCRC, which is actually not part of Telethon Kids Institute, it's part of the Child and Adolescent Health Service, offers biostatisticians, it offers anyone you could need to help you get your research projects off the ground, and it's such a valuable thing, and it's really increased the research, and there's lots of funding options as well through them and through the Perth Hospital Foundation. So I've kind of skipped ahead a little bit to one of the slides that's going to be coming up a little bit later, just to talk about being an RMO at PCH. But basically, as it's been mentioned already, the application process is conducted by PMH, slightly separately from the bigger hospitals. And it's not absolutely necessary to have prior experience in paediatrics, as many of you won't, but it is good if you can show that you have an interest in paediatrics. And that could be anything like your medical school elective, having volunteered with Radio Lollipop, having done an audit, done a publication if you can, anything that you can show us that you've got a bit of an interest in paediatrics. The cover letter is really important because we get lots of applicants, and sometimes it's people just throwing their net wide to see where they can get a job, and sometimes it's people who are really properly interested in paediatrics, and we want to be able to choose those people. So if you do have an interest in working in peds, even if it's because you want to do GP training or ED or something else, please do let us know that, put it in a cover letter. And I can say that I'm one of the people who goes through and marks these selection criteria and marks these cover letters, and we do look at things like that. So make it personal, show us why we should employ you and why you're interested. So in order to get into basic training, you do need to be employed by PCH. That's compulsory at this stage and will be going forward. I'm just going to jump a little bit. This slide, sorry, I have to leave, so I'm just going to skip ahead to the basic training part. Basic paediatric training, the absolute minimum time you can do it in is 6 years. So you do 3 years of basic training, 3 years of advanced training with a very difficult exam in the middle. Most people take longer than that. I took 10 years with 3 years of maternity leave tossed in. Paediatric training is very child and family friendly, very flexible, and we have a lot of part-time trainees. But I just want to check before I run away, if anybody has any questions about basic training in paediatrics that I can answer specifically. Yep.
How is it recommended that we should do it with certificate in child health or something, or before we apply for training? What's your thought on that?
Yeah, so there's, it used to be called the Diploma of Child Health. Now it's called something different, the Sydney Children's something. And it's looked at favourably in terms of the fact that you've shown an interest in paediatrics, and if you're planning to do paediatric training, it is a good basis for PEDS training. In terms of getting employment as an RMO, I don't think you need to necessarily have done that to get a job, but to get into basic training it would always be helpful, and it's not too onerous, it's very interesting, so if you're interested I would advise doing it, but you don't necessarily need to get an RMO job. Some people would have the job and then do that to get onto basic training. Yeah. Any other questions? Yep.
Are there extra, sorry, probably looking ahead a few years, but are there extra qualifications that you have if you're a GP in terms of paediatrics? Would that be the child?
That would be the Diploma of Child Health, yeah. So I'm sorry, I can't remember the new names, the Sydney something. But yeah, that's a lot of GPs would have that as well, and that covers quite a lot of the sort of basic things that you would need to know. And then if there was an area that you wanted to upskill in, sometimes there's an option to do maybe a 6-month job where you would do some ED or even leave relief. You get to cover quite a lot of areas of the hospital. Some of the surgical specialties are quite good for that as well. So if you're planning to do general practice, getting some experience at PCH is definitely recommended. Yeah. Anyone else? Yeah.
Sorry, that program you're talking about, is that the Sydney Child Health Program?
That's the one, yeah. Yeah. See, Sydney something. Okay, so just quickly to let you know about basic training as well in paediatrics. Prior to this year, if you wanted to do paediatric basic training, you just sent an email to the college and you just joined. Last year it became a competitive process, so you will be expected to submit your CV and cover letter, even if you already have a job at PCH, and you will then get scored on that and then go through a series of many interviews. So I think it was 6 that we did, and that process will be explained to you if you're interested in going through the application process for basic training, but it's not a shoe-in in the way that it used to be in the past. It is competitive now. All right. Thanks very much.
Okay, so I'm just going to go through the CRP program for the metro areas. As Nicole discussed, there is a CRP program for WACS. There is one that is usually run for the metropolitan area. It's run through Silver Chain, and you're predominantly at work in either hospital in the home or palliative care. This is subject to funding. So we do say in your application there is, as Nicole discussed, an option to select whether you are interested in a rural position or a metro position. If you can put your metro position and then make sure that you're uploading your CV with your application so we can send them off if the program does go ahead for the year. You need to indicate this in your application process. If you put in no, it becomes very difficult at the end if you suddenly decide that, oh, this is something that I want to do. We cannot necessarily change that for you. I'm also going to run through preferencing sites and split contracts, just because it does get a little bit difficult to and in relation to placements. So you'll be asked to put in at least 3 preferences. If you are using WACS as your first preference, it will, as Nicole said, you'll have to go through preferences within WACS, but then you put in your next preferences, so Royal, Perth and Charlie's. If you're unsuccessful in your first preference, and we already have the others as a backup, and those particular sites are aware that you are interested in going to them as well. With your split contracts, you can opt to do 6 months in one site and 6 months in another site. So if you are putting a split contract in, you could do PCH for 6 months and King Eddie's for 6 months. Your next preference might be PCH Royal Perth, and then you can put in another site. We can't guarantee that you are definitely going to get a split, but you are more than welcome to put it in and we can see what we can do for you. When you're doing a PCH King Eddie split, obviously that is a highly sought after position set. It gives you all the specialist sites. Are there any questions about splits or preferencing when you're putting in your applications? No? Okay. Does anybody have any other questions regarding the RMO process, in either from the sites or in relation to the actual physical process? Yeah.
If you put 2 specialist hospitals, so like first preference PCH, second preference communities, do you include the selection criteria for both?
Yes, for both of them, and you will be required to then put another option in, and that is one of your primary employing health services. So that could be WACS or it could be Royal Perth, Charlie's, Fiona Stanley. We do need you to put, you can't just put all of specialist sites. We do need one per site in.
When you answer the question, you just want to repeat it back so that we hear it.
Yeah, sure. Anybody else? No? Thank you very much for coming. If you do have any questions that you think of after you've left, you're more than welcome to email through to pmcwa.rmo@health.wa.gov.au, and we can try and answer any questions. If you have questions, please feel free to come and ask.